The Musculoskeletal System, Group 5, Shantez, Stella, and Xochi, Lara, RNs. What is the musculoskeletal system? It's composed of bony structures that provide stability to the soft tissue of the body. It protects vital organs. It provides storage space for minerals. It produces blood cells in the bone marrow. It provides stability and mobility for physical activity. And it's also the first line of defense against external forces. What is the composition of the musculoskeletal system? It's composed of bones, muscles, joints, ligaments, tendons, and the spine, cervical, thoracic, and lumbar. Why is the musculoskeletal assessment so important? It's used to perform a functional assessment for patient safety, to inspect for body movement, posture, and symmetry, to inspect and palpate spine for contour and tenderness, to assess gait and balance, to assess muscle tone, movement, strength, mass, and range of motion to joints, as well as to perform a peripheral vascular assessment. The equipment you will need for a musculoskeletal assessment includes a skin marking pencil, goniometer, scale, tape measure, and reflex hammer. The musculoskeletal assessment consists of inspecting posture, movement, and body symmetry. To do this, you will have to watch the patient's gait and balance. Does the patient use walking aids such as cane, walker, or wheelchair? You will inspect patient's position in sitting or lying down. Is the patient able to turn side to side while laying down? Is the patient able to dangle feet when sitting? During this assessment, you will also inspect and palpate the spine. You will inspect the spine from lateral point of view. You will inspect this for spinal curvature such as kyphosis, lordosis. You will inspect spine from posterior point of view. You will inspect for scoliosis, palpate vertebral column for tenderness, and you will inspect alignment of hips and shoulders. You will also inspect the limbs and symmetry. Inspect the skin for color, skin hydration, scars, lesions, rash, bruises, or IV sites, anything abnormal in the skin. Inspect and palpate shoulders for muscle symmetry and size and tone. Move to elbows, then forearms, then wrists and hands. Inspect joints and muscle tone for bilateral symmetry. You will also palpate muscle strength, joint range of motion, and crepitus. To do this, you will assess muscle strength symmetrically. You can use the 5-point scale for muscle strength or grip, for the grip. You can assess range of motion of joints, shoulders, elbows, wrists, thumb, fingers, hips, knees, and feet. And you can palpate for crepitus discomfort or pain. You will also perform a peripheral vascular assessment, but this is optional. You will check the bilateral radial pulses for rate, rhythm, and amplitude. Check the bilateral dorsalis pedis pulse. Assess skin color, hair growth, and temperature. You will also assess the gait. Inspect smoothness of gait, inspect heel to toe gait, and arm movement. Watch out for small halting steps, uneven gait favoring side, wide base gait, and foot drop. There are certain normal findings and certain abnormal findings that we should look for when assessing the musculoskeletal system. While inspecting, normal findings would include bilateral symmetry, bilateral alignment, bilateral length, and circumference. The abnormal findings in the inspection will be lordosis, kyphosis, and scoliosis. Normal findings with palpation would be no discomfort, firm muscle tone. Abnormal findings with palpation would be inflamed joints, heat, tenderness, swelling, crepitus, pain, and resistance to pressure. Range of motion and muscle tone. Normal findings will be passive and active range of motion. No pain with movement. Assessment of muscle tone is done with passive and active range of motion, slight muscle tension, equality between contralateral joints. Abnormal findings in the range of motion and muscle tone will be pain, limited range of motion, spastic movement, joint instability, deformity, and nerve supply. Normal muscle strength will be extending and flexing by applying force to muscle bilateral, extending and flexing by applying resistance bilateral. And abnormal muscle strength will be weakness to muscle, atrophy, pain, fatigue, overstretching, and disability. Introduction of the teaching plan for undergraduate students. The learning objectives for undergraduates will be the students will identify the functions of the musculoskeletal system. They will also identify the components of the musculoskeletal system, conduct a history related to the musculoskeletal system. They will demonstrate the assessment techniques of the musculoskeletal system, and they will recognize abnormal findings of the musculoskeletal system. Content outline consists of introduction to the musculoskeletal system, the importance of assessing the musculoskeletal system, the assessment of the musculoskeletal system, material needed, PowerPoints, handouts, skeletal system, picture of bones, and a teaching plan. The teaching plan will consist of lecture notes, learning styles with oral or technology-based presentations, visual displays, independent and team research. We will also have role playing. We will have the students take turns in playing the part of a patient, and the other will do the assessment on that patient. We will have simulation and audio visual, which will include videos, DVDs, demonstrating an actual assessment. The course schedule would include reviews, it would include simulation labs, it would include quizzes, it would also include practice for the student to practice on each other as patients. It would also include a written final exam as well as a Sims lab exam. The evaluation process will consist of a written exam as well as a simulation evaluation form and checklist. The next slide will show complete hands-on skill evaluation for undergraduate students. The simulation evaluation form will look for certain things that the student would be doing. Example, hand hygiene, that the student introduces themselves, they verify that they have the right patient, they communicate with the patient or family member, they do the assessment of the musculoskeletal system correctly, they identify any problems found, whether it be pain, swelling, redness, crepitus, cracking, the fact that they delegate appropriately, for instance, like radiology tests or MRIs, or provide care. And these are some of the things that we'll be looking for and checking off for. And there is an example of a musculoskeletal assessment on this link. So please feel free to go to this link to observe an actual complete MS assessment. And thank you for watching.